Hello and welcome to the Trent Fleming School of Nursing Simulation Hub CUPE orientation. Today I will be going through the vision statement, the mission statement, and some of the important aspects of what we do here in the Simulation Hub with regards to the students that attend Trent. First, let's look at the vision of the Trent Fleming School of Nursing Simulation Hub. The Trent Simulation Hub will be a regional center of excellence for interdisciplinary simulation education. The hub will be a space which brings health and life sciences education to life in Ontario for students and professionals as they engage in lifelong learning to deliver the best possible care for patients. Next, let's review the mission of the Trent Fleming School of Nursing Simulation Hub. Our mission in the hub is to bring health sciences to life in Ontario for students, nursing professionals, and the entire healthcare community. We are motivated to provide an inclusive, transformative simulation learning environment dedicated to learner success and exceptional simulation education. We are committed to promoting patient safety, social justice, and relational inquiry through robust community partnerships. In order to achieve our mission, we do the following. Integrating evidence-based practice, simulation standards, and guidelines from SSH and INAXL. Integrating evidence-based practice guidelines for training and working with simulated participants. Engagement of leadership to support continued development of faculty and staff. Creating an exceptional learning environment where participants develop critical thinking, clinical reasoning, and psychomotor skills through simulation learning activities. The simulated learning environment will scaffold learning to promote knowledge translation from simulation to the professional practice settings. In labs. First-year students complete labs in fall for Nurse 1100 and winter for Nurse 1020. During the lab, students will cover health history taking, nutrition and assisting feeding, integumentary, musculoskeletal, gastrointestinal, genitourinary, cardiovascular, and respiratory system assessments, as well as vital signs. In the 1020 term, students will look into enema and suppository administration, ostomy appliance application, and stoma assessment, urine, fecal, and sputum collection, transdermal and topical medication administration, pressure points and pressure wound assessment, PPE, hand hygiene, patient personal hygiene, bed making, and lifts and transfers. During their second year, students in Nurse 2021 have half mental health and half maternal child clinical placements. All students complete the non-violence crisis intervention training within the term. During the 2021 lab, students complete a head-to-toe assessment review, a maternal child simulation, and a pediatric simulation. Further labs consist of medication administration by sub-Q, IM, oral, and ID routes, with an OSCE testing on one of these skills, and a lab on maternal child content. This includes postpartum care as well as newborn assessment. What we cover in labs continued for third year. All 3,000 level students complete labs at the term start consisting of the following skills. Lab 1 is either 2 to 3 hours long and it covers head-to-toe assessment review and aseptic technique wounds. Lab 2 is 4 hours long and it will cover intermittent catheterization and dwelling catheterization, intravenous therapy and medication delivery, intravenous initiation, and nasal gastric insertion and management. The Lab 3 is also a 4-hour lab which covers care of an artificial airway, suctioning, subcutaneous line insertion, insulin injections, prep, mixing, and administration, postmortem care, respiratory care and chest tubes, blood transfusion therapy, and enteric nutrition. In 3020, clinical students complete 4 unfolding case studies on the weeks opposite from their clinical. They also have an OSCE testing at the end of the clinical term.
3021 clinical students complete 4 unfolding case studies throughout the clinical term as well on the weeks opposite of their clinical, and they also have an OSCE testing at the end of their clinical term.
Process of remediation for students in the TFSON Simulation Hub. All student years levels Blackboard sites have a Miss Lab Simulation case study folder. They are instructed to contact their CI, course lead, and the TFSON Sim Hub for any absences from lab activities. This includes their case studies or any labs. For makeup, labs, case studies, and simulations, these are assigned as needed at a time that works for the hub and the students. For remedial, please follow the information in the Blackboard folder for the SSPs, Student Success Plans. There is one for a student prompt and one for a student comprehensive.